welcome everyone to this month's webinar, where we'll be discussing the Total Healthcare Expenditure Model. And this is something that I've become very interested in, and I hope you will too. A couple of quick housekeeping items before we get started. We encourage and invite questions, and we ask you to please type those into the chat window, and we'll try to address those at the end of the presentation, so feel free to do that. I want to introduce Commissioner Bettencourt, but before I do that, I really wanted to mention that at the department, we're very privileged, I believe, to have Dr. Aziz as a colleague. And it's not just because of his knowledge, although he certainly is very learned in this area. It's not because of his expertise that he's developed, although certainly that'll come through. It's his passion. And so I think that's going to be something that you'll enjoy here. So without further ado, I'll turn it over to Commissioner Bettencourt.
Well, thank you very much, Andrew. And I must say that those words are spot on. So I appreciate it. So as Andrew mentioned, my name is DJ Bettencourt. I have the pleasure of serving as the Commissioner of the New Hampshire Insurance Department, and I am pleased to welcome you to this month's webinar. So this month's webinar will explore the Total Healthcare Expenditure Model, which is an innovative approach to understanding and managing healthcare costs. It's a huge priority for the department. We believe fundamentally that one of the biggest barriers to individuals having access to care is, in fact, cost. And so we want to provide you with an in-depth overview of the Total Healthcare Expenditure Model, which focuses on its potential to enhance both healthcare efficiency and value for patients and providers, again, with an eye towards keeping cost under control, ensuring that the premiums are affordable while never doing anything to undermine the quality and value of the care that individuals are receiving. As Andrew mentioned, we are privileged to have this presentation led by Dr. Jason Aziz, the Director of the Department's the Department's Data Analytics Director. He's had a couple of different titles there, and I forgot which one he's in at the moment, but he is doing a phenomenal job in his current role. And he is going to, again, share insights on how this model supports New Hampshire's commitment to healthcare transparency, which has been a long-term focus and project for us as a department, as well as consumer-focused initiatives. So with that said, I will turn it over to Dr. Aziz.
Thank you, Commissioner Bettencourt and Andrew, for those kind words. The privilege and honor is absolutely mine, and it's an honor and privilege to be able to speak to our audience today about something that's important to me. And yes, indeed, I do have a passion for all things that related to the health of our population. So this Total Healthcare Expenditure Model is something that we've worked hard here at the Insurance Department with the great support of Commissioner Bettencourt and all of my other colleagues. You know, our goal with this is to create transparency to the citizens of the state, to our legislators, to industry, and to providers on how much healthcare costs and where do we spend that money. So I'm really proud of all of our team's efforts and successes with this, and we welcome your feedback. The purpose of today's presentation is to give you the background and show you how we measure this, but also importantly to elicit your feedback, because here we truly do care what you have to say, and if there's something that you want to see out of this model, we want to hear from you. So let's get started. The first thing I like to try to do with something new is answer three important questions. What? What is this? Why? Why are we trying to do this? And then how? How, in this case, do we create this important set of measures? I hope I can achieve those three important goals. So let's start on what is total healthcare expenditures. It's a statewide tracking tool that allows us across all domains of the state healthcare expenditure pathway to track total healthcare spending. You're about to see a few slides later that we do indeed spend a pretty penny on healthcare. We want to show you where all that money goes. We try to give you a model that stratifies these expenditures by the different payers. You'll see what I mean when we get to our equation a little bit later. We also try to communicate this important quantity information based on service category, meaning where in the healthcare delivery system are these expenditures taking place. The purpose of this is to allow for future tracking of growth in total healthcare expenditures. I mean, it's one thing and not a trivial piece of information, but for this year, how much did we spend? But it's even more and more valuable to understand how does that compare to previous years and what we might expect future healthcare spending to look like. So tracking healthcare spending growth is an important underlying target that our near future holds for us. This will allow us to answer important questions, us being policymakers, legislators, and industry experts on what sectors of the system are exerting greater cost burdens and maybe even saving the system money, and where can we make changes to better improve our healthcare delivery system. The outcome that we hope to achieve from this, as Commissioner Bettencourt mentioned, are improvements in efficiency and improvements in value of the healthcare delivery system. Later on in this presentation, I have a few slides that I call stunning slides or stunning statistics. They show that we do have mighty healthcare expenditures in this country, but they also show that in terms of producing health outcomes, we rank relatively poorly compared to other similar nations. What that tells me is that we don't necessarily get great value on our healthcare expenditures. So by tracking expenditures this way, it allows us a unique insight to find out where we can make improvements on the value in our healthcare system. That can help patients and providers alike. I hope you look closely at those metrics that way. So to contextualize the importance of the macroeconomic view of total healthcare expenditures in a large market like the healthcare system, it's one of our biggest industries in the country. It might be helpful to contextualize it at the individual level. Let me use myself and my family as an example. I have a nutrition background, so it makes sense and it's relevant to share my supermarket receipt. We all see these, we all get these. And I've heard someone say before, you can tell a lot about a person by looking at their market basket. Moreover, you can actually tell even more about a person by looking at their supermarket receipt. And I can gain valuable insights about the foods that I buy, the economics of it, and also, tangentially, implications about my health status just by looking at my basic supermarket receipt, something that everybody gets and we're all very familiar with it. For example, I can see how much I spend on grocery, and I can identify whether or not I'm spending enough on produce. If I need to increase my fruit and vegetable intake, I can look right at this receipt and start to reallocate my weekly expenditures, which are pretty mighty, into a market basket, pun intended, that might help to improve my health. And I view our healthcare expenditures very similarly. You can also tell other things about the way that I spend money on food, something that has a direct impact on my health, and what I could do differently in other areas. And here you might even be able to tell that I let my college-age daughter shop for me and she takes $40 cash back. The point of all this is that by knowing what we spend our money on, we can make changes that make us better off. And I'd like our healthcare system to reflect this to a certain extent. And later I'll give you some examples on what that might look like. So that's the what. Now here's the how. How do we measure total healthcare expenditure model? First, we need to start by measuring total medical expenditures. And we do that by the different payment sectors in the healthcare financing system. We have commercial payers. We have federal government payers, the Medicare fee-for-service and Medicare Advantage plans. We also have state payers such as Medicaid and Medicaid fee-for-service. And another example of a federal payer is the VA system. So these are holistically all of the different insurance payers that pay for our medical costs. But that's not where it stops. We also need to measure the net cost of private health insurance. I sometimes refer to this as the administrative cost of healthcare delivery. We'd be remiss to acknowledge, especially in this current environment in our society, that such hefty expenditures can be financed without a significant structure put in place. And that's where the net cost of private health insurance fits into this model. So we look at it across these similar domains of payers in these three categories: federal, state, and commercial payers. Then we merely put all of this together and we have a far more transparent macroeconomic viewpoint of what we spend our healthcare dollar on. And like any economist, I really need an equation to fully understand it. And so there you see it at the bottom of our screen. So I always feel like there should be a drum roll when I show this slide, and I'm really, really proud of our department's work on this and all of our stakeholders throughout the state, including our New Hampshire Medicaid office, our federal government, and our colleagues at the University of New Hampshire Institute of Health Policy and Practice that help kind of inform the department on how to best do this. We call this our 2022 New Hampshire Healthcare Dollar. It's the first of its kind, and it really is a crude representation based on service category of where the New Hampshire healthcare system spent its money in 2022. You can see the different definitions in the data on how we classified each segment of this expenditure model. So what's important, why do we express this as a dollar and not a pie chart? It's because, last time I checked, we don't buy healthcare with pies. We buy them with dollars. In fact, hard-earned dollars. So there's no better and more relevant type of graphic than a dollar bill to communicate where our healthcare dollar goes. You can see the different partitioning across the different areas that may be familiar to you with how we spend our dollar: inpatient facility and outpatient facility. It's noteworthy that the good doctor and the nurse, the actual people with names and families who are delivering this important health care to us, the patients, they get 28 cents on the dollar. And now more and more, we hear about the excess cost that prescription drug expenditures are exerting to our already constrained healthcare system. And you can see here in 2022, approximately 20% of total healthcare dollar was allocated to prescription drugs. So this is an important graphic. We have one for 2021, and the 2023 healthcare dollar will be coming out in the middle of the winter, so look for that coming soon. But also look for how this partitioning model changes from each year, and that can shed some key insights into how our industry is evolving and what may be some legislative targets and or opportunities to help make our system work more efficiently, thus providing better value to our citizens. This is another more graphical and granular tabulation of our healthcare expenditures. That's really another stunning statistic. In 2022, the net absolute healthcare expenditures in the very small state of New Hampshire exceeded $13 billion. We like to express that in a contextually relevant prose. In terms of the per capita expenditure, that was over $9,300 per person. And then below that, we exhibit that by market share based on those four different payer categories. You can see how that breaks down. And indeed, commercial market is close to 50% of the total healthcare expenditures in almost any state in the nation. And importantly, compared to other states that do this, which I believe there are 8, our partitioning looks very similar to our other states in New England that do it. This comparative viewpoint I thought important to share with you because it demonstrates the importance and the value of comparing spending growth by different payer categories. You can see for each year, 21 and 22 depicted here, that we can measure the growth in each sector with just 2 time points. Next year, we'll have a 3rd time point. And every year that goes, that we progress doing this important work, there'll be an additional data point for which that line that measures the growth, how much of an increase from year to year in spending do we observe, that line and the slope of that line in of itself is an important metric. And our data analytics unit here pays close attention to that spending growth. And we'd like to hear from our colleagues and our citizens on what your insights and interpreters of that growth measure is, because it's really important. And to me, it represents key opportunities for healthcare reform, which I think we can all agree that our healthcare system does have good opportunities for reform. Okay, the last question I want to help you answer is why? Why are we measuring this? And these slides are borrowed from our colleagues at University of New Hampshire's Institute in Health Policy Practice. They had a fantastic symposium last fall that talked about some of these key issues, the leading issues that help us to understand why is this important. Here you'll see that, the increase since 2001 of total healthcare expenditures. You can see that they are indeed rising. But what else is important to understand that is the little blue partition in each of those columns shows that the per capita share of total healthcare expenditures is growing, meaning the amount that each household spends as a share of their total consumption is growing along with the growth of our healthcare system. This next slide actually describes that in a more granular way. The top green line shows medical care growth over that same time period, and the bottom darker blue line shows the growth of all other goods and services. So we like to refer to the top line as medical inflation, and the bottom line is just merely inflation without medical care included in that. So you can see here that surely medical inflation is outpacing inflation in all other goods and services. We see that as not only a problem, probably a problem that most of our viewers are aware of, but also an opportunity to identify what are the key drivers of that medical inflation. We have skeptics and cynics anywhere, and I think that's healthy for productive discussion in policy changes. So I like to kind of talk about these next two constructs in that vein. First, the data that inform those previous slides are from national healthcare expenditure estimates. We could suffice it to just measure that using national estimates adjusted for New Hampshire's economy. But why do we get local endogenous measures at the state? I think my close colleague Alex Feldwebel shared this quote with me, and I think this answers that question. Why measure it here? Why get endogenous state-borne measures here? I think that, our legislature wants to know, what's happening in our state. But it is very true that healthcare is a local commodity. The people that are providing healthcare, the people that are financing healthcare, they're also citizens of this state. The hospitals that are domiciled in this state, they're also part of our economy. So it's key to get state-borne measures. I call those endogenous measures so that we can have our finger on the pulse of what's happening in the New Hampshire healthcare economy. This is a powerful quote for me, and I thank my colleague Alex for advancing my understanding of the importance of that. This is something Deb Fournier from UNH has shared with us, and it's remarkable because there's a strange dichotomy. Is it prices or is it utilization? Economists are always debating about this and many other things. But is it prices or utilization that's driving the spending increase? And this paper makes a strong argument that it's the prices and not utilization driving these total healthcare costs. I urge any skeptic or cynic to read this paper, and it'll advance your understanding and help bring us to probably a more common area with this kind of enigma. This is a proxy measure that I wanted to share with you that I added as a supportive proof for the price paradigm. So this shows in a bunch of different similar nations to the U.S., meaning similarly developed. They have similar economies. They may have different healthcare systems, but they have similar economies. And we look at countries like Greece, like Japan, and Sweden, who have as a share of their population, approximately 17+% is 65 and over. And we can all agree that a population that has a higher share of older adults will also have higher utilization in healthcare trends because older individuals oftentimes suffer a greater disease burden than younger individuals, right? So this is pretty agreeable in health economics data. So you can see that these three countries have that type of proportion of older adults in their population, and as such, probably higher utilization. Yet, compared to the U.S., who has about 12.3% of adults 65 and over at this time period, had twice as high per capita healthcare expenditure. So this is a proxy or surrogate measure that serves as a body of proof that it's prices and not utilization that are the key drivers to this really out of control healthcare spend in our system. And I wanted to point that out because there's not a consensus really in policy realms that aim to understand more about this enigma on that. So that's important. The next question is, why are we doing this? You know, a lot of our colleagues, you know, it's obvious that we work here at the insurance department and we regulate insurers. But it's noteworthy that insurance in our entire country, and in fact in New Hampshire, is how we finance the delivery of healthcare to our society. And now that we have approximately 96% of our society insured, it's an important responsibility that we take very seriously. And Commissioner Bettencourt really, you know, weighs heavily this important priority that he balances. And he mentioned it in his introduction, and I hope you heard that we have to balance the importance of preserving the high quality of healthcare with affordability to our New Hampshire citizens. And I know firsthand that every day we work really hard to ensure that. Not everybody sees that, so I wanted to point that out. The authority for the insurance department to do this important work, to measure the cost of care, to ensure the affordability is intact for citizens, rests in the statute that we have communicated here and linked. And this publication will actually be made available to all the viewers and anyone else in the state. And we urge you to go look at the statute to see that, you know, despite the work that's involved with this important endeavor, you know, we have the statutory responsibility to the New Hampshire legislature and the citizens of this state to make transparent where we spend our healthcare dollar on. And so you know, I felt remiss if I would not mention that to you, and it was a key part of the message I wanted you to leave with today. So there it is, and we welcome your feedback on that. So why now in New Hampshire? You know, in New Hampshire, I'm not sure if you know this, but we're viewed as a leader or an innovator in healthcare transparency. You know, and over a piece of evidence is our New Hampshire Health Cost website, where you can go there and shop for over 300 health and dental services. You know, that was an important innovation that actually preceded my work in this great department. But I'm proud to follow in the footsteps of my predecessors who built the foundation to start, you know, letting consumers know what you'll pay for healthcare. You know, if you think about all the things that we purchase, all the things that we consume, healthcare is one of the few things that we don't really know what it costs before we make our decisions on what we're going to buy, and importantly, where we're going to buy it. And that's one of the key things that we can change as consumers to help make our healthcare system function more optimally. Be more price aware and price sensitive. And that's not just at the microeconomic level. That's not just your healthcare market basket, but it's also at the macroeconomic level. We need to, as large employer purchases, understand where we can get the best bang for our buck. Where do we get the best value? So we urge all consumers of healthcare, which is all of us in society at all levels, to be more aware of the prices. It's important, and we're certain that will have a reformative effect on our system that's in massive need of reform right now. So here are a couple examples of our work in healthcare transparency. The New Hampshire Health Cost website, where you can go and find services that you might be in need of tomorrow or next week. But we also have important reference data on prescription drugs and the price and utilization, more at the macroeconomic level, but it's important because providers and hospital systems and even insurers who make decisions that affect large numbers of people, they can go see what the drugs that they're buying for their members are costing. And they may be able to learn, are there lower cost alternatives to these drugs that they may be able to improve the value for their large scale expenditures that they make. You can expect to see more of these transparency efforts emerge in our New Hampshire Health Costs website. And we welcome any and all feedback you might have for us in that endeavor. So this is just a quick summary. This is our first year of measuring this. We've learned a lot, and we've got a lot of support from state agencies and stakeholders alike. The purpose of this is to create a platform for the sharing of information. It's about transparency. We encourage the public and the government to interact with us to help inform improvements in the model and also to help potentiate its effect on the system, because it's not until that happens that we can see true improvements in the value and the efficiency, the two goals of all of this, take place and start to really benefit you, the consumer, at the household level. I am really thankful for the honor and the privilege by Commissioner Bettencourt and the New Hampshire Insurance Department and you, the viewer, for giving me the time to present this important material that, as Andrew said, I have a strong passion for. Thank you so much.
Well, thank you, Dr. Aziz. I think that passion clearly shone throughout the presentation. We appreciate it very much. Andrew, has anyone indicated that they've got a question?
No, I don't see any questions yet, but we certainly invite them here in the chat so we can address them now on the presentation. Or I've put our email addresses into the chat window, so whether you need to reach someone in our consumer services unit or you have a question about this or other topics, you can reach our communications unit. I'm not seeing any questions, but as Dr. Aziz says, we certainly encourage your questions and your feedback. Mr. Sink here, Tim asks, is it possible to get a copy of the slides? And Dr. Aziz is shaking his head. Yeah, we'll put those online somewhere and make them available to you. We will put them somewhere on our website where that makes sense. And if you want, you can email us directly, and that way I can send them to you directly, Tim. Yeah, you're welcome. Thank you. If there's any other questions, we're happy to address them now. Or like I said, we can see this and other webinars that we host every month on our YouTube channel. We encourage you to go there. There's topics for legislators, policymakers, consumers, whether it's health-related, property and casualty, or otherwise. I see another question here. Is this available as an article? It's not, but I encourage you to email us at communications@ins.nh.gov. I'll get you a PDF version of Dr. Aziz's slideshow. So without any further ado, I guess we'll turn it over to Commissioner Bettencourt for his closing thoughts.
Well, again, I want to thank everybody for joining us, and thank you, Dr. Aziz, for that wonderful presentation. As always, we appreciate you joining us, and we look forward to seeing you participate in future webinars. Thanks so much.